There we go. Now you folks on YouTube will have volume. It's always something, isn't it? Oh my goodness, what a week. By the way, those of you who are watching from the Iowa area, that was abrupt. Those of you who are watching from the Iowa area, next week I will be in Cedar Rapids, Iowa on Thursday with the Observation Hive. So I'll be in your town with about 30,000 of my dearest friends, and we will be at the Hy-Vee stores. Stay tuned to our Twitter and Facebook feeds so that way you know exactly what stores we'll be at and what times. But next Thursday, which I believe is the 27th, isn't that right, Mr. Sadler? The 27th of July, next Thursday, I will be in Cedar Rapids, Iowa with the Observation Hive at Hy-Vee grocery stores. So be sure to stop by and say hello. What? Mr. Sadler is giving me grief. He's giving me all kinds of grief. He's even pointing his finger at me. And he's telling me I should get a haircut. Lack of sense of humor. You know what's going on with my barber. Yes. My barber was having some heart troubles and actually having an adverse reaction to one of his blood pressure medications. Long story short, he'd been on an ACE inhibitor for many years and then developed an allergic reaction to that ACE inhibitor and had some swelling in his upper respiratory and had to go into the hospital while they got rid of that swelling, and it was a bad deal. He's doing better now. For those of you who don't know, my barber is Dad. That's his name. Actually, his name's Jerry Wolf. My barber is my dad. He still cuts my hair after all these years. He's the only one that can put up with me that long in a chair. But Dad is doing fine. He just gets a little bit tired and doesn't have the energy yet to be, taking the weed whacker to my scalp, which I'm thankful for. Thank you, Dad. Discretion is much appreciated. So that, Mr. Sadler, is why I'm starting to look like a sheepdog. If I'm not careful, Mr. Sadler is going to bring me a dog license. This is the weekly wellness webcast, and we've already wasted 5 minutes of me droning on about nothing. As threatened, as predicted, as promised, this week we are talking about skin cancer. Da-da-da! Skin cancer. Well, it's appropriate. It's summertime. People are out there at their pools. People are out there mowing their lawns, exposing themselves to the sunlight and, whatever else. The neighbors. Please don't do that. I have just embarrassed my whole family. Julius is even weighing in here saying that I need to get a haircut. Well, Julius, your genetics are part of why I have this hairline. Julius is also known as Mom. We're a family outfit here. According to skincancer.org, it's a .org, so you know that it has to be true. Actually, this is some pretty good information. I have cross-checked it, and it's some very good statistics. According to skincancer.org, over 2 million people are diagnosed with some form of skin cancer annually. That doesn't just mean that they're diagnosed with melanoma. There's many different types of skin cancer. 1 in 5 Americans, that's 20% of our population, will have skin cancer of some form in the course of a lifetime. An estimated 3,170 deaths from non-melanoma skin cancer will occur in the U.S. just this year. Between 40% and 50% of Americans 65 years or older will have had either basal cell carcinoma or squamous cell carcinoma at least once in their lifetime. About 90% of non-melanoma skin cancers are associated with exposure to ultraviolet radiation from the sun. Now for some melanoma skin cancer facts. 1 person dies of melanoma about every hour, which works out to about a little over 8,700 deaths per year directly related to melanoma skin cancer. About 86% of melanoma can be attributed to overexposure to UV ultraviolet light from the sun. Melanoma is actually increasing in its mortality rates within men, along with liver cancer and esophageal cancer. If you double, your chances double for developing melanoma if you've had more than 5 sunburns at any time in your life. But if you have 1 or more blistering sunburns in childhood or adolescence, then this will more than double your chances of melanoma later in life just from that one episode. This year there will be an estimated 45,000 cases of melanoma in men and 31,000 cases in women, just in the U.S. Now, granted, in the grand scheme of things, when you've got 150,000 people dying every year from lung cancer, 8,700 deaths, 87 plus, around 13,000 deaths a year from cancer, statistically doesn't look that bad. But come on, this is something that can actually easily be addressed. There's ways to cut your risk factor for these skin cancers, and it's called common sense. Boy, that common sense just kind of plays a role in so many things, doesn't it? One of the problems is people don't realize how dangerous skin cancer really can be. People think of skin cancer as being the less than lethal cancer. Now, statistically, if you're going to just look at the raw hard numbers, yeah, you can probably draw that conclusion. However, tell that to the 13,000 families that are affected by people dying from the skin cancer every year. Skin cancer is a problem, and it's a growing problem, as we see with the melanoma mortality rates. But it's not a bleak outlook. It doesn't have to be such a bleak outlook. One of the body's defenses is the immune system. You've got the skin, you've got the mucous membranes, you've got the immune system, you've got all of these things taking place in the body to help protect the body from invasion, from disease, from all kinds of things. And when you have this problem of skin cancer taking root within that skin, one of the barriers to disease is already breached. And then once that barrier is breached, the immune system has been compromised because now it's got to work a little harder. And once that takes place, that skin cancer that can then take real deep, firm hold on the body and spread. That's the problem with it. It just doesn't stay in the skin. It just doesn't stay and, eat a hole in the skin and make you look like you got a funny nose. it doesn't just eat the tops of your ears off. It gets into the body and then spreads and gets into the lymph nodes, gets into distal organs and distal parts of the body. That's the insidious nature of skin cancer. Now, once those body's defenses have been breached and cancer takes hold, even in the superficial layers of the skin, that cancer can spread. For folks who have their melanoma or other skin cancers detected early, the survival rate is 98%. But once that cancer metastasizes and spreads into the body, into the lymph nodes like we talked about, or those distal organs, that survivability rate drops to 15%. So the idea is, know what you're looking for and keep an eye out for it. So today on the Wellness Webcast, what I wanted to do was share with you some images, some pictures that will help support what I'm about to tell you. Now, those of you that are watching the live stream, I'm sorry we don't have the technology to pop this image up for you, but those of you that are watching this on YouTube, you should be able to see that. There we go. The YouTube archived recording, which will go into the vault in about 30 minutes, we'll be able to see this. Now, with regards to skin cancer, there's 5 things that you want to look for. In physical exam class during Oriental Medical School, this was one of the things that we had to learn, and that is the ABCs of skin cancer. Boy, that sounds really highfalutin, doesn't it? The ABCs of skin cancer, taking the mystery out of all that white coat stuff. The ABCs of skin cancer are just this. A, you want to look at the symmetry of that mole or that mark, that lesion. Is it asymmetrical? If it's asymmetrical, you may have a problem. You'll want to get it looked at. So asymmetrical is A. Regular moles tend to be very symmetrical. Regular freckles tend to be very symmetrical. But when you start getting something that is asymmetrical, that's not good. You want it looked at. Asymmetrical meaning one side is not necessarily representative of mirror image of the other side. There's a difference. Second category, B, is border. You want to look to make sure that that mark has uniform borders around it. If one of the borders is kind of faded a little bit, or they're kind of all chewed up, the borders of that lesion, then again, get it looked at. Third category is color. Skin cancer lesions are going to vary in color. Moles, freckles, they're going to be pretty uniform in color. Think symmetry again. But with a skin cancer lesion, that color is going to vary. You're going to have different shades, different depths to the darkness and the coloration on that lesion. The fourth category is diameter. Most moles are 1/4 of an inch in diameter or less. In other words, the diameter of a pencil eraser. So you want to make sure that if you start getting these marks on your body that are larger than a pencil eraser in diameter, you want to have that looked at. Now, the fifth category, which is not listed on the image posted on the YouTube video here, is evolution. A, B, C, D, E. E for evolution. The evolution of that lesion. If that lesion starts to change and develop into different shapes, different depths, different sizes, starts to grow, coloration changes. If there's any change in the shape, evolution of that lesion, get it looked at. It's so important to get these things caught early on. If you catch it early on, you can do all kinds of good, and the survivability is through the roof. Very rarely, when it's caught early, are these skin cancers difficult to treat. Now, the idea is, if you think there may be a problem, have it looked at. Do you have to go to your GP, your general practitioner? Do you have to go to a dermatologist and say, I've got these marks on my back? Well, that brings up another interesting question. How do you look at your back? Have a family member check you out once a month or so to make sure, over the summer months here, to make sure that nothing's changing. But if you do have this problem, go to a doctor that you feel comfortable with. Go to a healthcare professional that you feel comfortable with. It may be your GP. It may be your dermatologist. It may be your chiropractor. It could even be your acupuncturist, of all things. The people that see you and treat you and know your body are going to be the people that you're going to want to talk to about this. And you're going to want to have those folks make the determination, okay, does this look abnormal? Do we need to refer you out to somebody that can do the necessary analysis and get this thing fixed? So we've talked a little bit now about what it looks like, what it can do. Well, how do you prevent it? Well, you look at the CDC website, you look at all of the standard fare websites, and they're saying, put sunscreen on. Get your squeegee, put the sunscreen all over you, and then you'll be fine. I got a problem with that. I'm arresting the liver young as we speak. Okay, here's my problem with the sunscreen issue. Have you ever looked at the ingredients of sunscreen? I wouldn't want to put that stuff in my garden, much less on my body. There's some yucky stuff in there. So then, Mo, you're just being an extremist. You're just being weird again. That would be one of my sisters telling me that. Any one of them. Let's look at it from another angle. Let's look at it from a functional angle, the issue of sunscreen. I'm going to read to you an article from the To Your Health website. It's written by Jacob Shore. It's called The Sunscreen Dilemma. It was published June of 2009. He writes, experts have encouraged sunscreen use as protection against skin damage that leads to malignant melanoma. Unfortunately, these sunscreens prevent the skin from making vitamin D from sunlight, and many studies now suggest that vitamin D is protective against cancer. Didn't like my argument about the yuck that's in the stuff? Well, what about this? What about the whole issue of vitamin D? Vitamin D is vital to the body. Sunscreen is designed to block ultraviolet penetration into the skin. That's why it prevents sunburn. This is also why it prevents the production of vitamin D. Even relatively weak sunscreens, such as SPF 8, will block UV and vitamin D production. Malignant melanoma is relatively rare. It is responsible for less than 10,000 fatalities a year. In fact, we just saw that this year, 2013, they're predicting around this year they're predicting around 8,700 deaths from malignant melanoma. Other cancers cause far more fatalities. Lung cancer causes about 150,000 deaths a year, breast cancer about 40,000 deaths a year. In all, about 500,000 people in the U.S. die of cancer each year. William Grant, a major vitamin D researcher, estimates that vitamin D deficiency causes 100,000 people to develop cancer each year who wouldn't have it if they had adequate levels to provide protection, leading to, boy, that's a difficult sentence, leading to 40,000 deaths per year. Cedric Garland concluded, years back that 1,000 units of vitamin D a day decreases the risk of colorectal cancer by half. Giving everyone a moderate dose of vitamin D could, in theory, prevent 28,000 colon cancer deaths a year. Now, I realize that it may seem I'm just throwing numbers out here, but, well, this guy's throwing numbers out here. But this is some interesting questions that he's posing. Well, according to skincancer.org, 8,700 deaths a year from malignant melanoma. 500,000 people in the U.S. will die of cancer every year on average. And vitamin D is a potential help in preventing cancer. But even an SPF 8 sunscreen will prevent the body from synthesizing vitamin D. Do you see the dilemma? Do you see the problem here? This is interesting. In 1999, Martin Weinstock published the results of a meta-analysis of 13 epidemiological studies on the relation of sunscreen to melanoma risk. These studies showed a decreased risk of melanoma, but 3 of these studies showed a decreased risk of melanoma, but 4 of these studies showed an increased risk, and 6 were inconclusive. Let me say that sentence a little bit different. 23% of these studies showed a decrease in melanoma. 30% of these studies showed an increased risk of melanoma as associated with sunscreen use. 46% were inconclusive. You all right there, Mr. Sadler?
Yes.
Okay. 46% of these studies were inconclusive. And yet we're told, prevent your skin cancer by putting on sunscreen. Well, wait a minute. If only 23% of the studies are showing any benefit to it, and 30% are saying don't because it'll increase your risk, and 46% are inconclusive, I'd say, how in the world can we make that judgment call? In 2002, a review published in the British Journal of Dermatology yielded no more assurance that sunscreen is protective. To quote the authors, 2 case control studies showed a protective effect of sunscreen use, while 3 studies showed a significant risk associated with sunscreen use. 2007, studies of the Annals of Epidemiology tell us something else we would prefer not to read. Data from 17 different studies on sunscreen use were analyzed based on latitude. Basically what they're saying here is, when all the data were combined together, no protective effect was seen against skin cancer as related to sunscreen. It gets a little worse. In studies conducted at latitudes more than 40 degrees from the equator, sunscreen actually increased the risk. The odd ratio of getting skin cancer increased 1.6 times the normal rate. In simpler words, people were about 1.5 times more likely to get skin cancer above 40 degrees above the equator. Below 40 degree latitude, sunscreen did lower skin cancer risk ratios, but only slightly. So what does this tell us? This tells us that if you're going on vacation to the tropics, yeah, pack some sunscreen along, because you're probably going to be out in the sun all day, and if you can find one that's not filled with yuck, with most of the ingredients pumped out of the ground, go ahead. It may decrease your risk of skin cancer. Above 40 degrees from the... These studies are showing that it's actually increasing your risk. It's increasing your risk most likely because it's decreasing your vitamin D consumption. Your vitamin D is no longer able to nourish the body and help boost the immune system and help the body to then fend off these cancer cells. So what's a poor boy to do? Well, the Journal of Cosmetic Dermatology tells us that you need to use topical antioxidants on the skin to help decrease your risk. Well, that's an interesting thought. Go out in the sun, get done what you need to get done outside, and then when you come back in, do a little reactive care. There's nothing wrong with reactive care when done right and used properly. Put on something that's going to be very nourishing to the skin, something full of antioxidants to that irritated skin. Try to limit your overexposure to sun. Notice I said overexposure. Your overexposure is when you get burned and you start peeling and it just gets nasty. That's actually going to increase your risk for skin cancer. There's a fine balance that we have to keep here. Do you see that? The adult recommended dosage of vitamin D is 5,000 units of vitamin D a day is what you need. Now, how difficult is that to obtain? Well, you can take the pills, of course. Well, come on. It's always, always, always better to synthesize these things naturally than to supplement them. Granted, sometimes you're going to have to supplement, but it's best not to. So how do you get the body to produce 5,000 units of vitamin D a day? Well, here it is. You got to expose at least a quarter of your body. That's not hard to do. Quarter of your body. If you're going to be a chicken, it's about that much right here. Get a one-sided shirt. The recommended dose, you're looking at between 15 minutes and 2 hours of exposure in the sunlight, direct exposure into the sunlight on your skin, depending on how dark your skin color is. If you're real pasty and you sunburn, your skin burns really easily, that's going to be about 10 to 15 minutes of being out in the sun. Just when that skin starts to get a little bit pink, that's when you want to get that skin covered back up because you've gotten your 5,000 units. For darker skin folks, someone like myself, it'll take probably 30 minutes. For someone like one of my sisters who's very dark skinned, it's going to take a couple hours of sunlight. Know your body. And when you come in, when you cover up, when you get out of that sun, that's when you need to put on something that's going to be very nourishing to the skin. That's what our family does. We use the Propolis Rescue Balm. What a lot of folks are doing is they're using the Propolis Rescue Balm. They're putting it on their skin to nourish the skin, to help soothe any irritation on the skin. And that propolis and the nutrients from that virgin coconut oil, full of antioxidants, full of all good nutrition for the skin that gets soaked in and gets used by those cells. Not saying it's going to prevent skin cancer, not going to say it's going to prevent, cure, treat disease. There, we got the disclaimer in. Mr. Sadler's happy now. Doesn't have to call the lawyers on me to scold me. Once you've nourished that skin, you've given your body the building materials to repair, and you've given your body also the tools to fight its battle. And that's what wellness is about, is working with your body to provide the body all of the necessary tools that you need for better optimum wellness. There's so much we can go into. There's, I forget how many million contacts, million times skin cancer shows up on a silly Google search. There's a lot of information out there. That said, you got to wade through your information. Are you going to just pick any old thing that flies by, or are you going to find something that's actually legit? Don't just cherry pick your sources of information. Do the textual criticism. Do the digging. Weigh your sources out. Which one's going to be more likely to be correct? And at the end of the day, make your decision. If you've got a doctor who walks into the room, sits down at his computer, starts typing away, asking you questions, doesn't ever put his hands on you, might listen to you with a stethoscope, see how your breathing is, might listen for some heart sounds. Yep, you got a heartbeat. But if your doctor isn't putting their hands on you and actually palpating your body, listening to you, and when you say, hey, I've got pain here, and the doctor's not putting their hands in that area and palpating and feeling, if they're not listening to you and listening to your body, get another doc. Remember, medicine is part of the service industry, if you will. Medical professionals are providing a service. And if you are unhappy with the service they're providing, there are others. Find one that will give you the proper service, the care that you need. Well, I am now over, they're telling me, in my time. And the music will probably be coming up. Yeah, there it is. On behalf of my family and behalf of the entire Little Honeys Be Rescued Propolis Care family, I want to say thank you for joining me, and I want to say have a wonderful weekend. Be well. Thank you.